In the 1920s, one doctor had a radical idea. What if people paid for healthcare before they got sick? This idea sparked a movement that changed healthcare forever. But was it really for the better? Hi everyone, I'm Trey, and I'm an employee benefits broker and the owner of Medcore Brokerage. I've been in the insurance industry since 2012, helping businesses design and implement effective benefit packages. Today, we're diving into prepaid healthcare plans like HMOs so you can make the best decision for you and your family. Before HMOs, healthcare was a free-for-all. If you got sick, you paid out of pocket. There were no structured networks, no referrals, just expensive and unpredictable medical bills. This was especially difficult for rural communities where people had little access to affordable healthcare. In the 1920s, Dr. Michael Shadid, a physician in Oklahoma, saw this problem firsthand. Farmers in his community couldn't afford regular medical care, so he introduced a radical idea: a prepaid healthcare plan. Instead of paying for unpredictable medical bills every time they needed care, farmers pooled their money together into a shared fund. This fund covered doctor visits, hospital stays, ensuring they had access to affordable, consistent medical care. This was one of the first cooperative healthcare plans. It laid the foundation for what we know now as HMOs. Dr. Shadid's idea worked, but it took 50 years for the U.S. government to step in. In 1973, Congress passed the HMO Act, requiring large employers to offer HMO plans as an affordable health care option.
Well, we've participated in a study and have been maybe more of a moral than a planning force in this, in encouraging major organizations to investigate this so-called HMO, Health Maintenance Organization, because we feel it offers a chance for better medicine at lower cost to large employer groups. There have been 6 or 7 meetings in Dallas of leading employers, and there is considerable interest in the formation of one or more HMO systems in the Dallas area. I've been a management consultant 25 years, and anytime you try something on this new, you're going to get some very disruptive things happening. You could get a large reshuffling of medical practices in an area where there might be members of the HMO that would have to be taken into consideration. So I think some of the disadvantages will be the situation that Dallas faces. We may not have enough doctors interested in HMO practice, or it may be more difficult in Dallas than it might be someplace else.
The goal was to lower cost, improve preventative care, and create a structured healthcare networks that made medical expenses more predictable for individuals and employers.
Are you a business owner or HR manager who's not sure you're getting the full value from your employee benefits? If you're questioning whether your current plan is truly working for your team, or if the renewal seems a bit steep, check out my free benefits audit. I've included the link in the video description below. It's a no-pressure, personal review to ensure you're making the most of what you have.
So how do HMOs actually work? Unlike traditional insurance plans, HMOs have a structured providers network. That means you can only see doctors and hospitals that are within your plan's network. Every member must choose a primary care physician or a PCP who act as your main doctor and coordinate your healthcare. If you need to see a specialist, your PCP must refer you first. You can't just book an appointment with any specialist on your own. And if you go out of network, you're likely to pay full price for your care. Now let's talk about the pros and cons. The biggest advantage of HMOs: they typically have a lower premium compared to other health insurance plans. With fixed copays, you know exactly what you'll pay for your doctor visit. Plus, since all your care is coordinated through your PCP, you may benefit from better preventative care and fewer unnecessary treatments. But there's also downsides. First, you have less flexibility. You're limited to a network of doctors and hospitals, and if you go outside that network, you'll have to pay out of pocket. And second, specialist visits require referrals, which can add extra steps and delay on getting that care you need. And lastly, no out-of-network coverage means if you move or travel often, your access to care might be restricted. So what if you want more flexibility and don't want to deal with referrals? That's where PPO plans come in. In our next video, we'll break down what a PPO plan is, how it compares to an HMO, and which one might be the better option for you. Make sure you hit the subscribe button so you don't miss out. Providing the right healthcare benefits for your employees is one of the most important decisions you'll make as a business owner or an HR manager. At Medcore Brokerage, we're here to help you build the benefit package that supports your team and fits your budget. If you're looking for expert guidance, my contact information is in the video description below. Take care, and we'll see you in the next one.